Hello everyone and welcome to DR Cosmetic in Touch. Today we're going to have a section in English because I know a lot of you girls and guys are asking, well, everything is in Spanish. Not in this case. I have Dr. Guichardo with me. Thank you for coming.
Thank you for inviting me. It was very important.
And a lot of people always say, well, none of your doctors speak English, and that is not the case, girls and guys as well. Today we're going to be talking about hips and lats, more because I had maybe in the last 3 months about 92 questions, just asking and trying to understand what is the difference between the hip and when you actually come and get hips, or what is the difference between getting lats. And I personally always have felt that Guichardo is one of the best doctors when it comes down to defining that body, because he actually did it with me as well. And I had no hips, I had no butt whatsoever. And I give him so much credit for that. Doctor, so talk to us. What is the difference between hips and lats?
Okay, the big difference about hips and lats, it would be where the fat tissue is located. If I could use you as a model,
of course,
please. If you see her, if we divide what would be all the area of the hip in 4 basic thirds, the upper third, which would be the first third, the second, third, and fourth. See that what we'd really call hips would be located in the lower third, or in the fourth, and in the third, while lats are over here. Okay, so lats are always high. They are not hips. But lats wouldn't give you this curvy shape that you're seeing. The real curve, it's located in the bottom part, which is the hips. If you see, lats here are smooth until they come to this point. Okay, so the difference is that lats are really high, and the lower part of the hip would be considered exactly what we're talking about now, right now, hips. Okay. So, curves are very, very important, and basically in the female shape. So, when you're getting lats and you're getting hips, you're making a contrast in between 2 different curves. The curve of the waist, which is gonna come smooth to the complete curve of the lats, and the fourth part would be the hips. In that sense, sometimes you get a lot of lats, like right in this part, and it may seem like you have a curve of your waist. What you really having is a lot of lats. So that would be the basic difference. Here it's hips. Female bodies come most naturally, most of the time, with hips, okay? Depending on the skin, you could get a better curve. So there are some patients that would have some hip dips which come out here in the part which are the lats, the upper 2/3. If the skin is soft and it could expand, you could get lats and you could get hips. But there are some patients that their skin is really, really hard. It has a lot of collagen and a lot of fibrotic tissue, natural fibrotic tissue, and it will expand as much as she has. So that should be kept into consideration about both lats and hips.
So is it fair to say that not everyone qualifies to have lats and hips at the same time?
Okay, lats and hips are a unit. Mm-hmm. What you consider symmetric, and what really calls the attention is having both at the same time. But not all patients, like I was saying before, have the expansion of the skin to get them both. Okay, there are some patients in which they absolutely lack hips, but their skin doesn't expand. Or, although their skin expands, they are straight. So those patients are really difficult to make a curve in. Okay, when you transfer fat or when you inject fat, you expand the tissue and you expand the natural curves. Okay, there are some techniques in which you could more or less make a curve, but actually putting fat in a patient doesn't really make a curve. Okay, it just expands.
Understood.
Once you expand in the area, let's say this is expanding and you have a small waist, then this seems like a lot of curves. But when you really take a look at it, it seems straight.
Seems straight.
Okay, so in that sense, not all patients could have curves because naturally they don't have it.
Understood.
Okay, you just inject the fat and you make it seem as if you have curves.
You make it seem, so it doesn't mean that we cannot have. For those girls out there that are still hoping to get some, there's a chance. It's a matter of understanding your body structure and
Yes, it's a matter of understanding what is it that, where the surgery could get you. Okay,
Understood.
That's the most important part of it.
Now, after someone actually is able to get hips and is able, even though there's one unit, hips and lats, what is the right way in order for them to actually keep those looks? We get a lot of questions as, should I sleep? Can I sleep on my butt even if I have a BBL pillow? Should I just be sleep down? Should I, no.
Okay, that's a very important question. Okay, if we start in the immediate post-operatory time period, would be the first 72 hours to 10 days, up to 10 days. Once you inject fat, the fat needs from 7 to 10 days to be perfused. In a more colloquial language, fat needs from 7 to 10 days to be part of the new host, of the part what it is. It needs the blood, the new blood vessels would be take from 7 to 10 days to be formed. So that's a very important period of time. That's the time where you cannot lie in your hips, on no side. That's the time where you should be using your bobby pillow. That's the time where you should not sit more than 30 minutes continuously. And that said, that's why you should not take a plane on day 7 after surgery. Meaning, bringing upon all the other factors that you're exposed to, but most importantly, those 7 to 10 days, and if you have your breast done, then you should be using the bobby pillows. You should hydrate yourself as much as possible, and you should be eating. And the other fact that it helps too is the hyperbaric chamber. That's something that should really be taken care of in those first 10 days. After the fat is perfused, which be days 7 to 10, then the other part that comes is that there are going to be some fat reabsorption during 3 months. The fat reabsorption comes, your body is being injured, controlled injury, because it's done by a specialist, okay? But it needs fuel to cure itself. It's gonna take it away from wherever it is. So it doesn't matter how much care you take sitting in the bobby pillow, part of that fat is gonna be reabsorbed.
What is the percentage of fat then?
We're talking about from patient to patient, from 20 to 40, that's more or less the statistics.
I see.
Okay, there's one thing. Depends on the technique, there will be more or less reabsorption. The more liquid you have in the fat that's injected, the more reabsorption there's going to be. The less liquid it is there, which means the more it is actual, the fat tissue that's injected, the less reabsorption you're gonna have. But you're gonna have reabsorption. That's why when transferring fat, you need the most that you can get within the projected parameters, the legal parameters, to say that.
Understand.
Okay? So if you really need, let's say 400 cc's, and I give you 300, then the reabsorption fat of that from 20 to 40%, at the end, you're gonna have what, 100?
Yeah.
So you need the most that you could get, like I said, respecting all the health laws that they are established.
You talked about nutrition. A lot of doctors have different techniques of what they actually feel that the patient should eat and consume in that time. We have seen here some doctors feel that they should eat everything that they like. We have seen doctors that feel that they should focus more on like liver, more on the healthy side. What is your opinion on that? How do you feel your patients should actually?
The first 21 days are really important. Of those, then coming back the first 3, the first 7, and of those, the first 3. Okay. We're talking about here, let's say the most common surgery done, liposuction. Everybody that goes through liposuction is gonna have some shortage of hemoglobin and hematocrit. We're talking about some sort of anemia. And when you take fat out, you take energy out of the body. So we're taking liquid, we're taking energy, we're taking electrolytes, we're taking plasma out. The only way to give that back is by eating. So hydration is the most important part there. And hydration means that if you drink 7 glasses of water per day, once you have a lipo or you have a tummy tuck, you have a combination, you should double that or triple that. So we're talking about from 14 to 21 glasses of water or bottles of water per day in order to equilibrate what you have just lost. Calories are very important. You just lost one of the most important fountains of energy of your body. So you need to get that to your body again. So as much calories as you could get from wherever you get it. And whatever it means, that if you want pizza, hot dogs, whatever, you need to eat it. As of healthy food is important. When you eat liver, then you're getting iron. When you have some specific juices, you're getting iron, you're getting vitamin C. So you need all that, but you need to replenish everything that's taken out. Okay. For instance, a regular lipo would be taken out from 3 to 4 liters, and you would cut a flap of skin from 2 to 4 pounds. If we ground that, we're talking about going in a car and having an accident at maybe 40 miles per hour. You know how much trauma a body would get from that kind. Difference is that it's done by a professional with everything taken care of, so everything should come out. Everything should come the way in order for you to get better. But that's what you're facing, and the only way to get all the energy back is through eating and drinking.
Drinking a lot of liquids.
Liquids, yes. Water with electrolyte, juices, a combination. Eating all your proteins, the fat and the carbs that you need. Most likely you would need to eat, at least for those first 21 days, which I use with most of my patients, double or triple what you eat normally. That's not gonna make you get any more weight. Once you have surgery, your body is gonna start fixing itself, to use a word. And it's gonna use the energy whatever he could find it. That's why people, from being really inflamed, they start drinking. That's why most patients after surgery lose weight.
And
Yes?
I'm glad that you actually mentioned that, because most of the girls, and I'm going to focus more on girls than guys, because now is that we're starting to see guys, they don't want to eat much. They only want to eat, I don't want to, my looks to stay as I see them in the mirror, which is not realistic yet, because you're still
Yes.
swollen, you're still not at that stage.
Yes.
And they just don't want to eat. They just want to consume maybe a couple of bottles of water and a couple of salads, but that's not going to do it. So I do recommend you girls to really focus in the fact that you have to heal back and that you need to consume the right protein, as Dr. Guichardo mentions here. And the water, I kept saying, we even talked about it a few weeks ago. You 2 to 3 liters if you can per day. As much as it sounds, you should start practicing before surgery, really. So it's not a shocking for you, I cannot drink all this water. And then eventually you're gonna be able to start getting the hang of that.
Yeah, what you're saying is completely true. Like I said, after surgery comes the healing part. The healing part requires energy. And the body is gonna take that energy from wherever it could find it. If you don't feed the body with energy, then that's when you keep a long time with anemia, long time or with dizziness, feeling weak, having some sort of constipation, because that body needs that calories that were taken away in an acute way. Okay, so the only way to replenish those calories is through eating and through hydrating.
One last question for you.
Yes.
What is your opinion on wish pics? And I want to ask you, and take the opportunity, especially because I see the wish pic concept more in the American concept, right? Most of us that live in the United States, we tend to have that tendency of always going through a magazine or looking at a particular person that we admire, that we just love their looks. And we keep getting in our page, I really want to look like this person, right? I really want to look like, I want my hips like this person. But the reality of it, like I was mentioning in the past, is that we don't all have the same body structure, right? We don't all have the same, what I call in Spanish, nuestro cajón, right? Our body is just not the same. So I am very interested to hear his opinion, just in the fact because the wish pics concept still doesn't stop. Now we are starting to get girls that are asking, can I take my wish pic to my doctor to make sure that he delivers what he sees on that wish pic?
Okay, that's a very important question. It's my everyday practice. Okay, wish pics and expectations go hand in hand. Okay, and wish pics are just a guide. Some patients could get near to that guide. They would not look exactly as the guide, but they could get to that guide. And some other, they just don't. And it goes as the following. When you bring a wish picture, you should bring the picture of how that person in that picture looked before surgery.
That's a good point.
If you look like that person before surgery, then most likely you're gonna end up looking very similar to your wish picture. If you don't, then it's really difficult. Okay, wish pictures, like I said, are expectations. This is something I tell to all my patients. Expectations are just in the mind of the patient, male or female. That's one thing. And the other thing about expectations is that they are perfect. As human beings, we're not perfect.
We're not.
Okay, that's one thing. And the other thing is that we don't have the actual picture. That's why I said that wish pictures are just a guide. The real picture of how you want to look is just on your mind. No one has that picture. And no one is perfect. So you could bring your wish picture if you had the frame, el marco. Then you might look similar to that person. If you don't have that frame, you're gonna look, your doctor is gonna try to get you there as much as she or she can.
Correct.
And the most important part is that when you bring witch pictures, bring the before picture. Yeah, because sometimes those witch pictures are patients that have maybe 2 rounds, maybe 3 rounds, or are patients that already had it, some sort of the peculiarities of that, and the surgery enhanced them. Okay, so that would be about the witch. It's a good guide, and the physician is going to tell you if he could get you near there, or how near he or she could get you to that picture.
It's so important that we keep ourselves realistic to our body frame that we have. Can we actually get to something similar, closer to it? I've been stressing for the last few episodes now that I want you girls to really take a second, analyze yourself. Take a second, and when you actually go and pick that doctor, select that doctor, make sure that that doctor has the time to talk to you. Make sure that they actually can sit with you, even if it's 5-10 minutes, but something that you understand, because as we all know, surgery is not perfect. Anything can happen, and I'm going to continue stressing this because I want everyone to start putting that in the mindset that at the end of the day, if the doctor cannot see you at the beginning, then what can you expect as you go through the process, right? Something does go wrong, you need to have the support of someone to actually help you, and the best thing to do will be the team itself of whichever doctor you select in that case. Dr. Guichardo, I want to thank you for being here with us today. I've been trying to get this man here for months and months, but he's finally here, and I will see you next time.
Okay, thank you for the invitation, and thank you for everybody for being here. Thank you.